So this is an idea in progress. I wanted to think about a hierarchy for health coaching. A little bit like you've got Maslow's hierarchies of needs, which kind of work up from a base of sort of foundations you have to have, and that you build them before you get right up to the top. And my other favourite, Lencioni's sort of hierarchy, always five dysfunctions of team that build up from what you need at the bottom. That if you haven't got the first base layers, you can't build up to the top. So I wanted to think about that in terms of health coaching. So the three areas that I think of, and you could think of it as a hierarchy, or you could think of it as like building a house, really. And at the bottom, the foundation is people's self-beliefs. Then you're building on the sort of core pillars, which you could think of as like the walls of the house. And then at the top, you've got condition-specific considerations, which you could think of as like the roof or perhaps the internal decor of a house. If you like, it's the icing on the cake. So with your self-beliefs, I guess the question is, are you in the game? Is the person you're working with in the game? Are you as a coach able to be in the game? And this is all related to how the person thinks of themselves. Do they have that sort of core sense of, I can do this, that it's worth me doing it, and that I am worth enough to do this for myself? Those core pillars, then, I think of them as two core pillars, really, and these are the sort of features of sort of lifestyle, the things that you do to look after yourself, and your social setting, and I'll come into those in a second. And then the condition specific things are on top of that. Once we've got those two basics right, we build then the relevant techniques specific to a person's sort of health or social situation. So let's dive down a little bit more into those three levels. So the foundation of self-belief. And I draw two theories that I really like. Brian and Decky's self-determination theory, which has been going for many decades now and has clarified the value of people being in control, having autonomy, having sort of self-direction. That really enables people to do behaviour change well and to make positive changes themselves. And also Aaron Antonovsky's salutogenesis model, where he talks about the key factor being your sense of coherence. So effectively, does your life story make sense for you? And does how you're living have sort of value and meaning for you? If there's a sense of coherence about your life, then again, things flow really well for you in terms of health and social outcomes. And I think the insights it gives us for health coaching is that really, unless the person does believe they've got capability and reason to make changes, and that's, chimes to their core values, what matters to them, and that they're in control and it's within their control, then it's going to really limit their ability to participate meaningfully. So if you assess as a health coach that that's not there, it's not strong, this is where you need to start, and you have to build trust, build people's sense of autonomy and self-confidence and motivation, and really work on them and why it's worth them joining in and how it chimes to what matters to them or what matters to you. Then we've got that established, people are in the game, they're working with you. Then I think the next kind of core thing to focus on is the basic core pillars. So we talk about those lifestyle medicine pillars, and just generally, what's your diet like, your sleep, your stress, your movement, what sort of toxins or infections are ongoing, and actually sort of assessing those and seeing if there's things that are really jumping out. Similarly, as well, the other key pillar is your social context, what sometimes people call wider determinants of health. So, your relationships, whether you're socially isolated, your work and your finances, your housing and your physical environment, your access to safe spaces, all these things, your sense of security, all really important. And again, I think the insights here for health coaching is that you need to explore these with people and find out what's strong and positive for someone, or what might be challenging and an area of weakness that perhaps you could think about working with that individual. And then you're generating a very person-centered plan focused on what matters to them most and where they want to start. And you might be involving other people as well if there's a particular area where you need more expertise beyond your scope as a health coach. And then I think we come up to the top to condition-specific approaches. And then in my experience, these are the three key areas that most health coaches end up working in. Metabolic health, thinking about, obesity, pre-diabetes, diabetes, hypertension, and how that affects cardiovascular disease. Your metabolic health is key. Chronic pain, widespread musculoskeletal conditions, usually to do with central nervous sensitization, or what we sometimes call neuroplastic adaptations in the brain and the nervous system. And then your mental health. And of course, there's a lot of overlap with those three there, isn't there? Very often, poor metabolic health underpins the way our brain works. Our brain is the most metabolically active organ in the body, so that affects the way our nervous system works and the way we process things emotionally and mentally. And I think the insights here from a health coaching point of view is that you can learn specific techniques now. So let's say you've looked at someone's diet just generally, and you're trying to make sure they're eating a good, healthy diet. Actually, in the context of insulin resistance in poor metabolic health, or in sort of central sensitization in chronic pain, you might be focusing your approaches more specifically to their condition. And that will very much depend on your scope of practice and the training you've had as a health coach as to how far you can go with that. You'll undoubtedly be tailoring your support to the person as well, to what, again, they're driven to and how they'd like it delivered. Is it one-to-one? Is it part of a group with peer support? And the sources of information that you connect people with, whether it's kind of, websites, whether it's peer support, whether they're a reader, whether they'll watch things, whether they'll listen to things, that will all be very individual and very personal. And I think as a skill as a health coach is to work out what they're ready for, what their health literacy is, and what they can engage meaningfully with. Perhaps their activation level will come into play here. You'll undoubtedly, as a health coach, need to collaborate with other professionals. Again, thinking about your scope of practice and what you've already been trained and you're good at. But absolutely, the ultimate thing for me is whatever you do in these condition-specific things, you keep the person in control and you build their skills, knowledge, and confidence. So I hope I've rattled through there the kind of emerging hierarchy that I'd like to think about. I think it underpins what we at Peak Health Coaching do in terms of our training, and that we like to train health coaches to be able to deliver that basic foundation, to be able to help people to believe in themselves and believe their worth and they can play a part in their own healthcare. Then there's some real specific core pillars that all health coaches need to be aware of. And then there's some condition-specific things that we can build on top, depending on the coach's interest and the area that they work in. I think that's relevant in the NHS. I think it's relevant across workplaces and the wider society. So that's the way we're going to go. And I really welcome feedback around that as a model and an approach, and how it fits for you in what you're doing as a health coach, or what you want to achieve for your business or for your NHS service.